overcoming other challenges, specific issues. Modifying toothbrushes. An oral health professional or an occupational therapist can provide advice to modify regular oral hygiene tools to suit the individual's dexterity. This may include changing the handle size, shape, or texture. When a person requires full support. When providing a person with full support to complete their oral hygiene routine, it's important to position yourself correctly. This will help to protect your back and support the person in a non-threatening manner.
One of the main problems that most people would do is actually come from the front of the individual. It's actually quite threatening because you're falling into them and it's not very healthy for your back. It's a very good idea to actually come from behind the individual, have a towel handy. Jim, can you please rest back on the chair? Thank you. Have the towel ready, and that controls any moisture that might slip away. Stand behind Jim's right hand side and have your left hand supporting the chin. That actually supports the chin, and it's a very good position for people with involuntary head movements because it's quite supportive and reassuring for the individual. With your thumb, just touch the corner of the mouth, and that's a reflex. It helps most people to actually open the mouth.
Oral care for people with swallowing problems. People who are fed by a gastrostomy tube or are on a textured modified diet because they're unable to swallow safely require specialised and regular oral care. The person's oral health professional and speech pathologist must develop a safe oral care routine for the person so that daily oral care does not lead to aspiration pneumonia. Effects of medications. Some medications will hinder our ability to produce saliva, causing us to experience a dry mouth. Saliva helps to protect our teeth from tooth decay, and so people who have a dry mouth are likely to experience poorer oral health than others. If a person is experiencing dry mouth, ensure that they regularly consume tap water, especially after taking medications, unless they're on a fluid restriction or have difficulty swallowing water. If dry mouth persists, consult an oral health professional and discuss medication options with the person's doctor.